Hi everyone, welcome back to our YouTube channel. Today in this video we are going to discuss a third shift of the RRB 2025, right? Mainly there is an analysis of the previous year question paper, right? And when you are talking about the RRB 2025, this exam was held in the three different shift. We already discussed a first shift and second shift, and today we are going to discuss a third shift of the RRB 2025. What is RRB? RRB is a Railway Recruitment Board, and mainly it is one of the central competitive exam for to become a nursing officers, and mainly it has a huge salary, starting salary that is 70,000, right? And the analysis of previous year question paper that really boost your exam preparation skill, and also it boosts your competitive answering skill, right? So when you are going through the analysis of this competitive RRB 2025, so we are getting that the most of the questions are coming from the nursing foundation, anatomy physiology, and also microbiology, even though some of the questions coming from the psychology, and also there is a questions from the general knowledge, right? The current affairs, right? So that's why the analysis is very important. Why? Because it shows the how the upcoming question paper is, right? That's why I urge you to study as much as possible in the student life, and also you have to study the proper basic subject such as nursing foundation, anatomy, physiology, biochemistry, microbiology, even though psychology also. So most of the questions are coming from the psychology. That's why the while you are studying the annual exam, or when you are studying for a academic exam, along with the academic study you have to maintain a preparation for the competitive exam. That is the best way to save your energy as well as also saving your salary after the graduation, right? So think once, after the graduation your time has to dedicated to study, means you are losing your salary, and also you are losing your energy, and you are losing the time, right? So when you are in a student life, prepare for a competitive exam as well as the academic exam or annual exam, right? That is the smartest way to get a government job. Of course, the everyone is struggling for a getting government job, right? So you have to study before the who are studying, right? As much as possible study immediately, right? That is the best way to get a government job, right? So if there is a analysis, or if there is any doubt in the analyzing or explaining the solutions, please let me know in the comment box. Why? Because so next we have the in-depth analysis of the Norset 8, which was held in the February month, right? Why? Because in the September month we have going to write a Norset 9, right? So for Norset 9 we have a clear preparation, and also the student who are studying in a last year, a JNM third year, as well as a BSc nursing 8 STEM, right? Those can also apply a Norset 8, Norset 9 exam, right? What is Norset 9? Norset is a one of the competitive exam. You have to when you are clear this Norset exam, you are eligible to work in one of the reputed institution in India, that is AIMS, All India Institute of Medical Sciences, right? So there is a huge salary that is up to 70,000 for a freshers, right? So everyone struggling, and everyone keep hard working to get this kind of jobs, right? And you also studying, and you also have a clear vision or a clear. Here we have some of the MCQs from the third shift of the RRB 2025. Let us have an analysis. So here The first question is, which award was confirmed upon a PM Modi by a government of Kuwait? So this is the one of the GK question, and mainly these type of questions are asked in the central government exam like RRB, NORCET, ESI, right? So we have to prepare a general knowledge that is related in a which is coming in a current affairs. We have to read a newspaper for uh, clearing some of the general questions in the competitive exam, right? So which award was conferred upon PM Modi by government of Kuwait? That is Order of Mubarak Al Kabir. So recently, PM Modi visited to the Arabic countries. During that time, he confirmed upon a he confirmed award, that is Order of Mubarak Al Kabir. Next question: which cranial nerve is most commonly affected due to the increased intracranial pressure in the hydrocephalus? First, we need to understand what is hydrocephalus. Hydrocephalus is a increased CSF fluid within the skull, that is called as hydrocephalus. So mainly when the patient is suffering with the hydrocephalus, there is an increase in the intracranial pressure. If the intracranial pressure is elevated, the automatically the sixth cranial nerve that is affected. So generally that leads to a dysfunction of the sensory, that is eye movement, and mainly that leads to a diplopia, double vision, that may cause a double vision. Next, third question: what does UHID stands for in the hospital settings? So this is a very important question that coming from the current affairs newspapers. So the UHID, it was first implemented by All India Institute of Medical Science AIMS Hospital, and mainly then after it comes under Ayushman Bharat Digital Mission. So here the patient have a 14 number digits. When you go through the 14 number digit, you will have a complete medical details that available across the all healthcare delivery system. UHID means the unique health identification. So here we will found all the health records under Ayushman Bharat Digital Mission. Next, fourth question: which of the following positions should a nurse instruct a patient to avoid after a total ankle replacement surgery? Of course, the every nurse should know about the avoid a pain from the surgery or a post surgery, that is supine with the foot supported in a neutral position. That is a correct answer. Always, if the patient undergone a ankle replacement surgery, we have to suggest a supine position and supporting with a neutral position. Next, fifth question: Balsalazid is primarily used to the following condition. Here the important, this is a very important. See, if the any competitive exam there is a must and question from the pharmacology, they will ask a direct pharmacological action and with and medical indications, right? So here the balsalazid is the one of the anti-inflammatory, mainly it's given to the ulcerative colitis. Next, sixth question: which major arteries supply the blood to the large intestine? It's a very important question from the anatomy and physiology. So mainly that is superior and inferior mesenteric artery. That is the biggest artery that supplies the blood to the large intestine. Next, seventh question: what does the LAMA refers to in the healthcare settings? Of course, it is one of the very important question from the foundation, and mainly this is admission and discharge unit. LAMA refers to live against medical advice. See, remember one thing: the questions are coming from the all the subject. Don't neglect any subject. Next, eighth question: what is the correct depth of pressing for a deep palpation? So this is a question coming from the nursing foundation. So when you are collecting the data, so when you are doing the physical examination, of course there is a palpation. The maximum depth of the pressing palpation, that is 4 to 5 centimeter. See, remember one thing, all the questions are coming from the basic subject anatomy, physiology as well as nursing foundation. So be thorough with the all subject. Next, ninth question. What is the primary use of ganiometer in clinical settings? This is a question from the nursing foundation. Of course, ganiometer is one of the instrument we are using to assess the motion or a range of motion from the joint. Next, 10th question. Which part of the brain controls the involuntary actions such as blood pressure, salivation, and vomiting? Of course, this is also coming from the anatomy and physiology. That's why I am telling that. So don't neglect any fundamental subjects or any basic subjects such as anatomy, physiology, biochemistry, microbiology, nursing foundation. These are very basic subjects. And even though central government asking the very simple questions from these subject. So here the, the part of the brain controls involuntary actions. The involuntary means it is out of control of the brain. The correct answer is medulla oblongata. Next, 11th question. What is the primary mode of transmission for Salmonella? See, this is a question coming from the microbiology. They are asking about the mode of transmission of the one of the important bacteria, that is Salmonella. Of course, the Salmonella is one of the nosocomial infection and is also the mode of transmission, that is fecal oral route. Next, 12th question. When does the periperum period typically begins? Of course, after the delivery. So this is the very important question coming from the OBC. So periperum means the body recoveries after the delivery. That is, the answer is immediately after the delivery of the baby. Next, 13th question. The famous bronze statue of dancing girl belongs to which age? Here they are asking a history of the India or a historical question, or also it is coming from the general knowledge category. So dancing statue of bronze statue of dancing girl that belongs to Indus Valley civilization. Mainly it is ancient history. Next, 14th question. What is the first priority in the first and management of the snake bite? So here the answer is that is resonance the victim and immobilize the affected limb. Of course, if there is any emergency condition such as like a snake bite, we have to avoid a further injury and also prevent as much as possible the spread of the venom across the arteries or veins. The correct answer is that is resonance the victim and immobilize the affected limb. Next, 15th question. In the TMM classification of the cancer staging, what does NO indicates? Of course, this is a question coming from the adult health nursing or medical surgical nursing, and mainly that is the unit of oncology. The oncology, it has a there is a classification of the cancer, mainly that is TNMO classification, and here T refers to the tumor and N refers to lymph node and M refers to metastasis. Here the NO indicates lymph nodes are not involved. Next, 16th question. In the standard World Health Organization photograph, which symbol is used to record the maternal pulse? Of course, when the pregnant mother having a pain, we have to ready for the labor. So during that time, according to World Health Organization, we are making a photograph. So this is the one of the tool that records the vital signs of the mother, right? So in that photograph, we are mentioning the dot symbol as a maternal pulse. The correct answer is that is dot. Next, 17th question. According to Erickson, during which age range is the intimacy versus isolation stage most prominent? Of course, this is a question coming from the psychology. And here the Erickson explains the all in the psychological condition or psychological changes within the young adulthood, right? So here correct answer is young adulthood, that is 18 to 40 years. Next, 18th question. Where are the parathyroid glands located in the relation to the thyroid gland? Of course, this is a very important question coming from the anatomy and physiology. Here they are asking about the location of parathyroid glands that is related to thyroid. Of course, these are the correct answer is that is the embedded in the posterior surface of the thyroid gland. So this is the correct location of the parathyroid when relation to the thyroid gland. So if you are any doubt or any correction, that is, let me know in the comment box. 19th question. What is the primary legal purpose of having a patient sign in a llama form before leaving the hospital? So this is a very important question coming from the nursing foundation, and also this question is the one of the practical based question. So here the nurse has to understand the condition why patient is leaving from the hospital, whether he has a risk or else is moving from the further medical uh, care or whatever, right? So when the nurse should aware that when the patient is leaving, he has to sign a llama form. What is llama? Llama is the leave against medical advice, right? He has to sign this form, and then after he has the permission to uh, leave a hospital, right? Here the correct answer is to document that a patient is living voluntarily or understanding the risk. Then after is a living from the hospital. Next, 20th question. Which lymph nodes are primarily located near the heart and within the chest cavity? Of course, that is the mediastinal lymph nodes. This is a very basic question coming from the anatomy physiology. So when you are studying the subjects, don't neglect any topic, small topic. Don't neglect any small topics. Why? Because the questions are coming from the small topics, a very basic uh, concept, right? Next, 21st question, that is, what does the foul smelling lecher typically indicates in the postpartum woman? Of course, after the delivery, the complete duration that is taking to recover the normal body position, that is called as postpartum, right? So here there is a chances of getting infection. During that time, there is a secretion from the vagina, that is foul smelling lecher, right? So the answer is that is uterine infection or else endometriosis. Next, 22nd question. A child is on a long term nebulization therapy, which is bronchodilators. Which of the following side effects should nurse closely monitor? Of course, if there is any children on a nebulization therapy, we have to assess the tachycardia and also tremors. Why? Because the continuously nebulization that spreads or that gives the air drops of the bronchodilators. This is one of the medicine that influencing the respiratory secretion, right? So during that time there is a over secretion that leads to a tremors or a seizures or a chills, right? So if there is a respiratory that is having a excessive secretion, that leads to a tachycardia, right? Next, 23rd question. What type of necrosis is most commonly associated with the severe burn injuries? Right? So before going to the question, we have to understand what is necrosis. Necrosis is one of the pathological conditions that leads to a death of the cells. Right? So here the necrosis are of 6 types. First one, that is coagulative necrosis, second one liquefactive necrosis, third one caseous necrosis, and fourth one, that is fat necrosis, fifth one, that is fibrinoid necrosis, sixth one gangrenous necrosis. Among these, The coagulative necrosis is mainly responsible for the most commonly associated with the severe burns injury. Why? Because in the burn cases, there is a denaturation of the protein that leads to a death of cells, right? That's why the correct answer is that is coagulative necrosis. When you are analyzing the previous year question paper of the RRB, the most of the questions are coming from the most common type of disorders which are coming in the hospitals, right? So when you are preparing for a competitive exam, you have to focus on the most common disorders which are coming in the hospitals. Why? Because so when you are analyzing the previous year question paper, in all the questions they have used the examiner, he has used a most common type of the disorders or a most common type of the signs and symptoms, right? That's why when you are practicing or when you are going to a clinical, you have to assess the which are the common signs or a common disorders, right? Those are important for a competitive exam, right? And also while studying a more focus on the common disorders coming with the current affairs. Don't neglect this. This is one of the important key to success, right? All the best for your preparation and keep on studying. uh, all the best and join, and thank you for watching, and wait for a further analysis of the norset 8. Thank you so much.